So zygomatic implants and pterygoid implants are also known as rescue implants. These are implants that are used in scenarios where optimal conditions are not met. However, they are modalities that allow us to deliver teeth to the patients that same day. In many offices that are not skilled at doing these procedures or cannot do these procedures, the outcome is generally a denture at the end of the day, or the patient's not able to get a fixed set of teeth. In our office, we're able to always give those fixed set of teeth because we have the proficiency to do these procedures. Now, although these procedures are not our first goal and it's not what we aim to do, sometimes these are things that have to be done because of medical conditions, because of the quality of the bone, or even because of the lack of the bone that's been there. One of the most important aspects of this procedure, or with any surgical procedure, is that you want to be with a surgeon that can handle any and every possible outcome that could come about during the procedure. Just like any other procedure, a lot of things sometimes may not go as planned based upon our preoperative records and the x-rays that we've taken. You need to have a surgeon that's able to manage these difficult scenarios that might come about during a procedure. And one of the most widely used and one of the most popular used modalities that we use is extramaxillary implants, such as zygomatic implants or pterygoid implants. Zygomatic implants are implants whereabout we use the cheekbones, and pterygoid implants are implants whereabouts we use the most posterior aspects of the maxilla. Both of these are highly trained procedures which our office is extremely trained and proficient at, and we're able to use these treatments to give our patients the most ideal outcomes in sometimes the most toughest scenarios. Many patients come to us after years of not having teeth or after years of wearing a denture, and as a result, their bone has resorbed or their bone has become extremely soft. Other patients, due to other unforeseen medical instances, their bone becomes extremely soft, and you don't necessarily are able to anticipate that until you actually get into the procedure. And in doing so, you really want to make sure that you're setting this patient up for long-term success by placing these implants in solid, natural, healthy bone. And that's exactly what zygomatic implants and pterygoid implants offer us. It offers us strong stability, it offers us long-term outcomes and uncompromised outcomes where we're giving the patients the best possible treatment in sometimes a very unforgiving scenario. Another reason why our office is set apart in this regard is that because there are only a handful of surgeons specifically that are able to do these procedures. These are very advanced surgical procedures, these are very highly skilled procedures, but these are procedures for us which are very second nature. We have performed hundreds of these successfully in the past few years, and as a result, that's been part of the main reasons why we've had such successful outcomes in so many of our different patients, is because we've been able to treat every single case that walks through our door. So when it comes to selecting your provider for implant dentistry, one of the most important things is making sure that that provider is able to handle both the difficult situations and also the easy cases as well, and everything that's in between. With our office, we place over 1,000 and restore over 1,000 implants on a yearly basis. So when it comes to implant dentistry, there is nothing that we haven't seen, there is nothing that we cannot treat, and all the aspects of implant dentistry can be taken care of under one roof. Not only can the implants be placed here and the surgical aspects are performed here, but also the restorative aspects.